Hi, my name is Dr. Allison Sigal. I am a specialist in pediatric dentistry, and I am the founder, owner, and researcher at Little Bird Pediatric Dentistry. My practice is completely dedicated to the provision of airway-centric care, which includes tongue and upper lip tie assessment and treatment, myofunctional therapy, and buteco-nasal breathing. Our goal is to help children from birth onwards breathe, eat, sleep, grow, and live better. I'm going to play you a video that showcases the journey and impact that a tongue tie can have. This is a bit of a longer video. As you watch it, try to put yourself in her shoes and imagine how you would feel as a new mom or dad navigating the wild world of parenthood, trying to do the best that you can for your child.
Hi, my name is Kimberly White, and I'm a mother of two boys, Otto, who's 2.5, and Milo, who's 2 months old. I want to tell you a little bit about the story of Otto and his oral ties. Otto was born at 37 weeks on the day. He was my first boy, my first baby, and 3 weeks early, and so I was not fully prepared to be mothering a child just yet, but I was really excited when he arrived. The first day he was born at 5 pounds, 7 ounces. And so he was just a little guy and went down to 5 pounds by the end of the week, but was up to 5'7" within that 2-week time period. And so I thought, I figured it out. We've been breastfeeding. That must be going well. He's gained all his weight back. I can do this whole mothering thing. He didn't sleep the greatest at night. He would often wake up right away when we laid him down on his back. He also was quite stiff and would arch his back every once in a while. And so the midwife thought that maybe he had some acid reflux, but we were pretty excited that he had gained back his weight. Well, when the midwife came a couple days later and re-weighed him, Otto was still only 5 pounds, 7 ounces. And so from there, we had to begin to weigh him every single day. And that lasted for about a month of weighing him constantly. We had to go to the doctor's office every other day and get him weighed to make sure that he was reaching milestones, and he just wasn't gaining weight. And so at 2 weeks old, when this first started, we began supplementing with formula. And so I would breastfeed and then formula feed. For a little bit there, we even had some donor milk that was brought to us from the midwife so that he could still get breast milk in those first crucial few weeks. And so we would breastfeed, formula feed, or donor milk, and then I would pump while he was getting that bottle to try to up my supply. I also went to a lactation consultant who tried to figure out how to help me breastfeed, and they put me on medication, specifically domperidone, which they said would help make my milk come in better. And so I was on domperidone, which was a prescription medication, as well as some herbal remedies that the lactation consultant had prescribed. And so all of these things were supposed to help my milk come in and make it easier for Otto to breastfeed. At 6 weeks old, we finally were told that he probably had some kind of tongue tie, and we were sent to a doctor, an MD, to get that looked at. And so the doctor appointment was pretty straightforward. We went in, we saw a nurse who walked us through what the process would be if we thought that Otto did have a tongue tie. The doctor came in, lifted up Otto's tongue, said there might be a slight tongue tie, but due to the fact that he's not gaining weight, let's just give it a try. Took a razor blade, cut the tongue, and said, you need to do these stretches 6 times a day, and if you don't do those stretches, the tongue tie will grow back and you won't see any improvement. And so I became really stressed. It was up to me to make sure that Otto's tongue tie didn't come back and that we could see improvement. And so we would do these stretches multiple times throughout the day to try to ensure that his tongue tie didn't grow back. But he still wasn't able to get all the nutrients he needed from breastfeeding. And at 4 months old, I finally gave up on breastfeeding. The breastfeeding, bottle feeding, and then pumping, all were getting exhausting. It was at this time when a nurse recommended that I go off my domperidone because I was not going to be breastfeeding anymore, and she didn't want me to have any problems with an oversupply. And then a few days later was informed that I needed to make sure I slowly went off of that medication due to the fact that there were some extreme psychological side effects when you don't wean off it. If you went cold turkey, suicidality, psychosis, different types of really extreme psychological side effects that as a postpartum mother, you're already at risk for depression. And so the thought that now I was increasing my risk because I went on this medication so that I could try to breastfeed my son, and was going off of it because it wasn't working, was just even another battle and a hurdle to face during this time. And so Otto went fully onto formula at 4 months old, and I was so excited. People told me that when he hit 6 months and he started to eat solids, he would probably start sleeping better, and that he would probably sleep through the night. And so I really looked forward to that 6 month, light at the end of the tunnel. And at 6 months old, I did a ton of research. I love researching. And so I researched everything there was about how to feed babies. I did a whole baby-led weaning course online. I looked at all of the first foods that you should offer to a baby that give them the best nutrients. Anchovies was one of them. I would never in my life eat anchovies, but that was something that was recommended. And so all of these different things, I was fully prepared for my son to begin eating solids. And at 6 months old, when we'd offer them, he'd put them in his mouth and he'd kind of suck on them, but spit them out, which we were told was normal. And it's a tongue thrust and it'll happen. And at 7 months old, when that was still happening, we were told that babies all develop on their own time and their own schedule, and that we shouldn't rush it. Just keep bringing him to the table. So at this point, it was Canadian Thanksgiving, and I kept thinking, okay, when we get to Christmas, he'll be able to swallow at Christmas and he'll eat some Christmas meal with us. And we got to Christmas, and he still wasn't swallowing. He would just kind of chew or suck on the food and then spit it out. And in March, he turned a year old. And at this point, our family doctor realized that something really was going on, that maybe we should look into. And so she referred us to a pediatrician. And we went to that pediatrician, and he wasn't too worried about the fact that Otto wasn't swallowing solids. He was more so worried because Otto snored, and he snored loud. He was the loudest snorer in our house. And at first I thought it was super cute, but the pediatrician told me that snoring was not a normal thing for babies. And so he had to get an x-ray to check his adenoids. And so we did that. And the pediatrician wondered if maybe his adenoids were swollen, if that was contributing to his inability to swallow, if it was blocking his ability to swallow. And so we got the x-ray done. And I actually personally knew a pediatric radiologist. And so I sent him the images right away once we received them. And he said 100% his adenoids were within a normal range and that he wasn't concerned about them at all, and did not think that that was impeding Otto's ability to swallow. So we followed up with the dietitian, which is what the pediatrician recommended us to do. And when we followed up with that dietitian, she was really confused. She didn't know how she could force a child who wasn't swallowing to swallow, and looked at all the foods that we'd been offering and said that it wasn't a diet problem, it was a swallowing problem. So she referred us to a speech language pathologist at our hospital, or swallowing specialist, and so we tried that route. And she said that she didn't know how to help us, that she works with the elderly who lose their ability to swallow, but she doesn't work with infants who need to learn the ability to swallow. And so then they recommended that we meet with an occupational therapist. And so that occupational therapist and I had a phone call, and she had wondered on the phone if maybe this was connected to a tongue tie. And I informed her that we had gotten his tongue tie released when he was 6 weeks old, and we didn't think that this was tongue tie related. They threw out words like autism and a sensory disorder because maybe he didn't enjoy the feeling of food in his mouth and was spitting it out, and all of these things. And so she came to our house to do an assessment. And during her first assessment, she really did think this might be connected to a tongue tie. We'd already gone to see a chiropractor. We had gone to see an osteopath. We were really trying to figure out all of these pieces and the tension in his body. And the occupational therapist said, with all of those pieces lining up, the inability to swallow, the tension in his body, the snoring, the lack of sleeping through the night, all of those things, she said, could be connected to a tongue tie. And she said there was only one doctor that she would really recommend that we meet with, and that was Dr. Sigal.
This story is what we hear on a daily basis. How many healthcare providers does one have to see to find answers? What does this say? That systemically, across all healthcare professions, we have a problem. The education, information, and awareness has not evolved. Curriculums have not been updated. And simply put, The majority of healthcare providers do not know any better. I always say to my patients, everyone's doing the best they can with what they know, how they were trained. There is no blame game or how could this happen discussion. The problem this highlights, however, is the need to educate, the need to have this information be taught, be the standard, be the norm. And then we can save families from enduring these agonizing, unnecessary journeys, and instead allow them to thrive and enjoy the journey they are on. Now, let's see how the rest of Otto's story unfolds.
We drove 2 hours to Milton to meet at Little Bird Pediatrics Dentistry, and immediately felt like this was a different experience. We had a full assessment done, and this assessment was not like the one at the medical doctor's facility that took about 3 seconds, but it was a full assessment where, as Dr. Sigal was looking in Otto's mouth, she explained everything she was doing and what she was looking for. She explained how tongue ties would impact breathing and sleeping and all of the side effects. Her staff were amazing at informing us the importance of a proper place of resting your tongue so that it impacts your sleeping, and how Otto actually didn't have the ability to swallow because the middle of his tongue was anchored down. And so she told us that day that we could do the procedure. Otto was quite old at that point. He was 16 months, but he didn't have his molars in yet. And so she said we could do the procedure that day, or if I would prefer for him to have kind of a full surgery, we could look into that, an anesthesiologist and all of those pieces. And I had waited so long. I just needed something. And so I said, no, let's just go forward with it today. And so we did a tongue tie release and we did a lip tie release. The lip tie release wasn't as needed as the tongue tie release, but we did believe that there would be some benefits as he had 60% use of his lip. And so I thought, well, if we're already doing the tongue tie release, let's try to get 100%. Like, I wanted 100% for everything to really see if this made a difference. And so we did the lip tie and tongue tie release that day. And on the way back, we had a 2-hour drive. And so on the way back, we stopped to get some food at a Wendy's. And I remember handing Otto a French fry, and he loved chewing on French fries and would spit them out. And he chewed up the French fry and he swallowed it. He didn't spit it out. And for the first time in 16 months, Otto swallowed a solid. And it was an amazing moment for my husband and I. I don't think Otto fully understood the implications, but for us, it made a huge difference. At 16 months, he was still drinking 3 to 4 bottles in the middle of the night because milk wasn't filling him up. And so we were waking up in the middle of the night to feed him. He wasn't getting all the nutrients he needed, so we had to do blood work to continually check that he wasn't becoming iron deficient. Trying doing blood work on a 16-month-old child, it was torture, having to hold him down and do all of these different procedures. And after that one appointment with Dr. Sigal, he was able to swallow again. Otto still swallows, 2.5 years old, and he loves his food. He doesn't snore. He sleeps better at night. He still doesn't sleep perfectly, but he sleeps better. He's a fully thriving 2.5-year-old boy. And we are so thankful for the help that we got at Little Bird. Not only did he go in that day and get the procedure done, but then we went back 2 days later and they walked us through how to do the stretches properly. And they took pictures before and after so we could see the difference. And then 2 weeks later, we went back again to check on the healing process. I felt supported throughout the whole time versus when I went to the doctor's office and got this little razor that just sliced through his lip or his tongue. And then they said, okay, if you don't do it right, it's not going to work. It's going to grow back. And that was that. No follow-up, no support, no reaching out. But Little Bird Pediatric Dentistry did all of that. Dr. Sigal did all of that. And it changed our lives, and it changed Otto's life. So when Milo was born, 11 days later, we were in Dr. Siegel's office again. People kept asking, has he had signs of a tongue tie or seeing symptoms? And I said, I don't even care. I want only one person to do a tongue tie and lip tie assessment. And that's Dr. Sigal. And she looked, and sure enough, actually Milo's was more extreme than Otto's was. And so we were able to avoid all of those barriers and hurdles. And Milo's 2 months old now. He's gaining weight and he's exclusively breastfeeding, which was a dream that I had with Otto, and I wasn't able to do it because of that tongue tie. So we are so thankful for her insight, for her wisdom, for her dedication to this profession, and the way that she helped our family tremendously, and we will always be thankful to her.
Testimonials like this really show the impact that a tongue tie can play and the opportunity for all of us to learn, grow, collaborate, and be able to be part of the solution. I urge you to trust your gut instinct, and for parents, your parental gut instinct. I always say that parents know their children better than anyone else. If you feel that something isn't right, follow that intuition. I encourage you to use this QR code on our website to download, view, and share our age-specific self-assessment checklists of airway compromise across all ages. These checklists are incredibly accurate in predicting patient needs and those who would benefit from airway-centric care. If you're answering yes to many items, it is worth seeking a consultation with a healthcare provider. Remember that we are stronger together, and the time to share this information for the assessment and treatment of tongue ties and provision of airway-centric care to become common knowledge and standard of care is right now. Thank you for watching, and please share this information with your family, friends, patients, and communities, as everyone deserves to live an optimized airway-centric life.